Discover health sciences at Robeson Community College. Now, here's your host, Christina Dees.
Students at Robeson Community College are discovering careers in healthcare, and as a result, they are elevating their success, gaining employment in high-demand fields, making a difference, and creating a bright future for themselves and their families. If you've always thought about a career in healthcare, sit back and enjoy the next 30 minutes as we tour Robeson Community College's health science programs, starting with Associate Degree Nursing. We're here inside the nursing lab and classroom. This is Missy Britt. She's the Associate Director of the program, here to tell us more about the Associate Degree Nursing program.
Yes, ma'am.
So tell us, what types of things do students learn while they're in the program?
Well, the most important thing that they learn while they're in the Associate Degree Nursing program is how to take care of patients. Our focus is truly on safe, quality patient care. As you can see behind me, the students, they learn all types of skills, from vital signs to starting IVs to Foley catheters, a whole gamut of how to take care of patients.
And how does this differ from, say, a university?
With our students, it's more fast-paced because it is an associate degree and not a four-year degree, so it only takes them 2 years, so it's a lot more fast-paced. And with the associate degree nursing program, they get a lot more hands-on, so we're actually in the clinical facilities a lot more than universities are.
Well, that's exciting. And what is the pay grade like once they graduate from this program, and what's the job outlook?
The job outlook is vast for nursing. Nurses can go anywhere this day and time, from clinics to hospitals to dialysis to home health. And right now, these individuals will graduate in May, and they are looking at about an average of a $30 an hour starting pay.
Wow. Well, how do I get started in this career path? You know, nursing is in demand. So how do I get started, and what are the requirements?
The very first thing you have to do is apply to Robeson Community College. So we're going to put that in there first. And then once you start or apply to Robeson Community College, then you would take your what we call prerequisites. So you're looking at your A&P 1, your A&P 2, English 1 and English 2. Once you get those out of the way, because those are prerequisites to the program, and of course a certified nursing assistant as well, then you can actually apply to the nursing program. Our associate degree program admits students every August, and applications are typically due in May. So as soon as we get them, we start admitting our new cohort.
So after I complete the program, what opportunities exist? Can I just go straight into the workforce?
You can go straight into the workforce, and because the associate degree nursing program is actually nationally accredited through the NLN-CNEA, you're actually also eligible for federal jobs. But if you want to continue your education, which I always encourage my students to do, you can go into a four-year university, get your bachelor's degree, and then you can go on to master's, and you can actually go on to your doctorate in nursing as well.
I'm here with Summer Locklear. She is a soon-to-be graduate of the nursing program. Summer, how has the associate nursing degree program helped you achieve your goals?
Robeson Community College ADM program has helped me achieve my goals by supplemental instruction, such as after class we go over the topics that will be on our exam to be successful in passing our test. We go over next-gen questions, extended questions. They've also helped me achieve my goals by being helpful in clinical, being a guide in clinical, and as well as our new goal that we just implemented was getting partial credit on our test. So that helps us to be successful on our exams to reach NCLEX to be able to graduate.
So what are your plans for the future?
My ultimate goal is to be a clinical coordinator registered nurse.
And then what would you say to someone considering a career in nursing?
I would consider to never forget your why. Just have that compassion, because nursing is a work of art, and it takes a compassionate person to be a good nurse.
If you've always dreamed of becoming a nurse and you can devote just 1 year, you can become a licensed practical nurse through the Practical Nursing Program at Robeson Community College. Here to tell us more is the Director of Nursing, Marie Hedgepeth.
Hi.
Hello. Will you tell us more about the Practical Nursing Program?
The Practical Nursing Program is a diploma program where it only takes 1 year. You can complete the program in 1 year. We actually just started this past year. We started the Practical Nursing Program in 2012 here at Robeson Community College.
And how does this program differ from the ADM program on campus?
Again, it is a 1 year program. It's a diploma program where the ADM program is an associate degree, so you actually get a degree with the ADN program. But we also have the philosophy that learning is a lifelong process, so we have the opportunity to bridge even after completing the diploma program.
And what kind of job opportunities exist for a licensed practical nurse, and what's the average pay?
The average pay for a licensed practical nurse is anywhere from $24 an hour to greater than $30 an hour, with the average being somewhere around 25. They have the opportunity to work in multiple areas such as acute care, home health, long-term care, clinics, urgent cares, things of that nature. They also, if they choose to work in clinics and urgent cares, they get usually a Monday through Friday job with the weekends and holidays off. So it is more family friendly.
And how do I get started on this path? What are the requirements?
With the practical nursing program, first you make application to the college, and then you would have to complete the prerequisites, which are Bio 168 and English 111. And you would also have to be listed as a nurse aide on the nurse aide registry. And that's basically all of the prerequisites for the practical nursing program.
And then after I complete this program and I want to continue my education, what kind of opportunities exist?
As I said before, we do have the opportunity to bridge into our ADN program here, and then you would only complete 1 year. Once you complete the associate degree program, we also have another bridge where you can bridge through UNC Pembroke and get your BSc in another year.
Shaitasia, what would you say, or how would you say this program's helped you to achieve your goals?
It helped me achieve my goals because I always wanted to be a nurse ever since I was in high school, and now I'm here, I'm graduating, and I think it was a great experience.
What are your plans for the future?
I want to become an RN, so I'll be back next year at RCC. So,
What would you say to someone considering a career in nursing?
do it. It's going to be hard, you're going to have bad days, you're going to cry, but as long as you got a good support system, good teachers, and good peers, you'll be able to manage.
And you seem to enjoy your time here at Robeson Community College. What would you say to someone considering enrolling as a student here at RCC?
You should. It's a great experience.
We're in the operating room at Robeson Community College, home of RCC's surgical technology program, and it's time to get prepped for mock surgery. Come along and learn step by step from the students on what it takes to become ready in a surgical environment.
Oh, my joy.
All right, this is Willie Dunbar, and he's going to show us how to get prepped for a mock surgery.
All right, so upon coming in, you're gonna grab your soap from up here.
Okay.
And so first you start with an initial hand wash.
Okay.
So you wash your hands like normal. The soap over here. So next thing, you wanna take your nail pick, and you wanna pick your nails while underneath the water. Yep. Kind of moisten it just a little, squeeze it to get some of the suds going. And you wanna take the bristle side and scrub, for 30 strokes. So the arm that you start with, do the whole entire arm, and then you will switch. Yep. Okay. You just want to do a sweeping motion. So go through. Good. And then you would dry. The same way you kind of scrubbed, you want to dry in the same motion.
Take it through.
Yep. So you got armholes on each side. Yep. You got it.
Make it work.
And pull that up.
This is serious.
Yes.
No germs.
None.
Well, I'm all prepped and ready for surgery. This is just one of the many things you will learn in the surgical technology program here at Robeson Community College. Here to talk to us more about the program is the program director, Rietta Coleman. You have a 100% pass rate for the national exam, the national certification exam, and a 100% employment rate. So you must be doing some things right. Can you tell us more about the program?
Sure. The program is 4 semesters. Students begin in the fall and complete the following December. Students are trained in preoperative, intraoperative, and postoperative surgery. They're trained how to sterilize the instruments, prepare the operating room for surgery, and we tell them to always put the patient first.
Well, these students just started the program not that long ago, and they seem to already know what they're doing. They seem to know their way around. How long does it take to become a surgical technologist? You start in August?
Correct. And we complete the following December, 4 semesters. It's a very fast-paced program. Students begin clinical rotations during the 2nd semester. And unlike most programs, these students are an active part of every surgery from day 1 of the clinicals.
And what kind of job opportunities exist for these graduates with the degree in surgical technology, and what's the average pay?
Most graduates will go into the operating room to work. Some will go to labor and delivery units, physicians' offices, veterinary offices, or dental offices. Average pay is usually around $26, $27 an hour. We have graduates that currently make upwards of $28.50 an hour.
Oh, wow. Well, how do I get started in this program, and what are the requirements?
So the prerequisites for the program are Anatomy and Physiology 1 and 2. We also offer information sessions, 1 per month, so that anyone interested can come and find out a little bit about the program and the requirements. And that information can be found on our website.
And after I complete this program, can I continue my education, and what kind of opportunities may exist?
A lot of students go back to school, they complete their first assist, and they become certified with that. Some even go back to complete a Bachelor's of Applied Science in Surgical Technology, and every now and again they'll go into another allied healthcare field.
If you've always wanted to work in healthcare, but you're looking for something a little less invasive, maybe a career in medical sonography is just for you. Here to talk to us more about the medical sonography program at RCC is Lindsay Norris, Program Director. Lindsay, tell us more about the sonography program here at RCC.
Yeah, so it's a curricular program that will provide students with the knowledge and the clinical skills to use high-frequency sound waves to take images inside the body. This program will also properly train the students how to use the equipment, how to take diagnostic images, and how to document findings.
What kind of job opportunities are available for a career like this, and what's the pay grade like?
So the graduates may be eligible to work in clinics, physician offices, hospitals, and educational institutions. Right now, the average pay scale for an entry-level sonographer is $30 to $38 an hour.
And just curious, are there any specialty careers in sonography? And if so, are there any further requirements necessary?
So specialty careers may include abdominal, OBGYN, breast, musculoskeletal, pediatrics, and vascular. And if the student does choose to become more specialized, they would just take those appropriate certifications to receive those credentials. There's cardiovascular sonography that if the student chooses to pursue that, it would be extra education and certification as well.
And I imagine more pay.
Yes, more pay.
So how do I get started? What are the steps I need to take? Are there any requirements?
So students that will be applying to the program need at least a 3.0 GPA in the general education courses that are required for the program. These include Bio 163, which is basic anatomy and physiology, or they can do Bio 168 and 169 combo. There's also Physics 110 and 110A, which is conceptual physics, Math 143 or higher, English 111, English 112 or Com 231, a social behavior elective course, and a humanities elective course.
And what makes medical sonography a good career path to take?
Medical sonography is challenging, but it's also very rewarding because it kind of helps guide the physician's diagnosis and the treatment plan for the patient. I also believe it's a good career path because it's very broad and there is many career opportunities and advancement.
So what's a typical day look like for a medical sonographer?
So it depends on really where you're working at. So if you're at a hospital, you may be doing OBGYN, abdominal, vascular, a little bit of it all. If you're at a physician's office, you may be just doing OBGYN. You'll just be doing that all day. And also, it's just not always a 9-to-5 job. Sometimes you may work weekends or night shift. Of course, you'll be compensated for that pay also. Sonographers also take call sometimes, so that's another way to just get a bonus extra pay.
Perfect. Well, let's check in with one of your students now and hear their testimonial. This is Emma Turbeville. She's a soon-to-be graduate of the medical sonography program at Robeson Community College. Emma, how has this program helped you to achieve your goals?
As a 2-year program, it really helps me to get my degree quickly in an affordable and convenient manner. I feel like I like sonography because there's many different ways you can go with it.
All right, well, what are your plans?
I plan to become a registered vascular technologist, possibly getting my registries in abdomen and OBGYN as well. I also plan on getting my bachelor's degree in healthcare administration whenever I'm done.
And just curiosity, so getting those additional certifications, is that additional time in the program?
No, it's not. I actually can just take my registries after I'm finished.
And is that to make yourself more attractive in the workforce?
Yes, it'll make me look a lot more attractive to different kinds of sites, different kinds of labs. It really helps getting jobs.
What would you say to someone considering a career or a future in medical sonography?
I say go for it. There's a bunch of different ways that you can go. There's a bunch of different tests you can take. There's different kinds of pay levels that you can do. I really like sonography because of all the things that you can learn and how much you can learn.
And you must be enjoying your time here at Robeson Community College. What would you say to someone considering enrolling at Robeson Community College?
I say don't overlook community college. You can always take classes here if you're not sure what you want to do before you go to a 4-year. So take your classes here, go to the 4-year. There's also different kinds of healthcare programs that you can do if sonography doesn't seem like something you'd like. There's radiography, respiratory therapy, and nursing.
Respiratory therapists are in high demand and are much needed in our hospitals and care facilities. And did you know you can get this degree in that field right here at Robeson Community College? Yes, you can. Here to talk about it is the program director, Kelly Hustis. Kelly, would you start by telling us what is a respiratory therapist? What do they do?
Respiratory therapist is a person who works close with physicians. We treat a variety of patients from premature infants to elderly patients with chronic lung diseases. The program actually will prepare them to function as registered respiratory therapists, where they will learn and master here at Robeson Community College patient assessment and treatment skills to include life support, ventilation, and drug administration.
What classes can I take here? Do I need experience? And how do I enroll?
To enter the program here at Robeson Community College, respiratory is really easy to get into as far as what you need to take beforehand. There's only 4 classes. Your prerequisites are chemistry, biology 1, English 1, and math. And our basic math is just that, basic math, what you graduated high school with. There's nothing advanced for it. There are other classes you can take in addition to that to get you further along, but they're not required to get in, just those 4. You can take your humanities class, arts, music, philosophy, psychology, all that stuff ahead of time, and it helps you glide through the program easier.
And how do I enroll?
Applications open every year in January. We enroll every year in August, and it is 21 months straight from August all the way through. 1 summer out of your life is what we tell our students, and then you get to graduate the next May.
What type of job opportunities are available once a student completes the respiratory therapy program at RCC?
The majority of the jobs are located in a hospital where the employee will work as critical care therapist. They can work on med-surg. They can do cardiac centers. They can do LTAC centers. They can even be sales representatives outside selling the equipment. And for the most part, for outpatient-based situations, they can do diagnostic testing and pulmonary rehab.
And how long does it take to complete the program? I know you just said that. Will I be certified when I finish?
So upon graduation, students are enrolled to take a national registry, and our goal is to get every student to be registered respiratory therapist. So we have a 100% pass rate for that. We've done really good on preparing our students for that, and it is an out-of-pocket fee for our students, but they are prepared and ready to take that exam as soon as they graduate.
And would you share with us, what is your greatest joy about teaching here at RCC?
The joy about teaching here is we have students that come here ready to give 21 months of commitment to learn and gain the knowledge that they need to become a successful respiratory therapist. You have students here that come from all walks of life, but in the end they all join together in one class. They get to learn a lot. They get to attend the clinic or to attend several different clinical settings, and it is awesome to see the student actually become a member of the healthcare team and to earn this rewarding career.
It's allowed me to work right here in my community and be able to obtain a degree while taking care of family working part-time. As soon as I graduate, I would want to register to take my test, get my license in North Carolina, and also later on I plan to go to UNC Charlotte to obtain my bachelor's degree.
And what would you say to someone who's considering a degree or a career in respiratory therapy?
It is a good field, and especially here at Robeson Community College, the teachers are well invested. There's a long history of passing rate. You have a 100% pass rate and a 100% job placement as well as after graduation.
And last question, what would you say to someone who is considering coming to RCC or maybe even considering going to get a degree?
It would be a good choice to come to Robeson Community College. The teachers are really invested in their students and really care, and they're going to help you to make sure you know what you're doing.
You can look beneath the surface for a degree in radiography from Robeson Community College. Technologists are in high demand right now, and at RCC they have a 100% pass rate on the exam and employment rate for the past 7 years. Here to talk to us more about the program is Candace Ward, the program director. Candace, welcome to the show. I just want to jump right in and let everybody know, what can they expect to learn in this radiography program?
Students can expect to learn how to use critical thinking skills to position patients and how to use radiation safely to obtain images to help in the diagnosis of patient conditions throughout the body.
Now, there's a lot of programs out there. What sets RCC's program apart from other programs out there?
I think small class size and the opportunity to interact with students one-on-one is what makes us different than other programs.
Now, I mentioned you've had a 100% pass rate on the national exam and a 100% successful employment rate for the past 7 years. What are you doing to get those kind of numbers?
We do have a competitive application process as well as very high standards for the program, and I think the fact that we can get the best students into the program to make sure that they can handle the rigor of the program, and then also our standards make it to where they're more valuable employees afterwards.
Yeah, and we also mentioned that technologists are in high demand right now. What's the job outlook like? What can they expect, and how much can they expect to make? What's the pay grade?
Job outlook is at an all-time high right now, and entry-level technologists can expect to earn about $22 to $26 an hour on just a normal shift, but if they're willing to work nights, weekends, or even travel a little ways, that pay rate or that pay grade would increase substantially.
And there's a lot going on in this room. Can you just talk us through some of the equipment and what students can expect when they come in the program?
In order to give students the most realistic idea of what they'll be doing in the clinical setting, both of our rooms are set up exactly like a hospital room would be, and so students position each other. The instructors check for accuracy, and then we use phantoms when we actually do need to make exposures.
And if someone watching this right now is thinking about this program, what are the requirements?
Students who apply to the program have to have at least a 3.0 GPA in the 8 general education courses required for the program. Those are Anatomy and Physiology 1 and 2, English 111 and 112, Math 143 or higher, a Social Behavioral Science elective, a Humanities elective, and a Medical Terminology course.
And assuming that they meet all those requirements, what would you say your best advice is for someone considering a career in radiography?
I would say that they can learn how to be the most competitive applicant by attending one of our information sessions that we hold twice a semester, and you can find the dates for those sessions on the radiography webpage on RCC's website.
Perfect, and we're going to hear a student testimonial from one of your senior students. Let's check in with her now. I'm here with McKenna. She's a senior student in the radiography program. McKenna, why did you decide to enroll in the radiography program here?
I knew that I wanted to do something in healthcare, but I also knew that nursing was not for me. So I started researching and came across X-ray, and I realized that I could still do patient care and be involved with that and trauma and fast-paced situations while not having all of the different requirements that come with nursing. And as soon as I saw that they had their 100% pass rate for the past 7 years, I knew that this would be a program that would challenge me academically and push me to do my best.
Yeah, so what are your plans after you graduate?
After graduation, I plan to work part-time in X-ray while obtaining a certification in CT, also through Robeson Community College's continuing education, and plan to be certified in both of those modalities in the upcoming months.
And what would you say to someone interested in applying for this program?
I would say that it is a great program. It is definitely going to challenge you, but it is so worth it, and these instructors really do make it easy for you. They are going to teach you what you need to know, but they're also going to push you to do your very best.
Yeah, and what would you say to someone interested in RCC?
I have had a great college experience at RCC. I think that all of the professors I've had, both during my prerequisites and in this program, have all been amazing, and they've challenged me in many ways.
In addition to offering 2-year degree programs, RCC also offers short-term training that will help you get your start in the medical field and open up new doors of opportunity, and may even help with your application into one of the health science programs we featured earlier. And with a program like EMT, after completing many certifications, you can then go for your associate degree completely online. Looking for a career that's action-packed, thrilling, and helps save lives? Look no further than the Emergency Medical Services Program at Robeson Community College. Here to tell us more about the program is the clinical director, Thomas Ferd. Thomas, I'm ready to jump into ambulance and start the program. What are the steps that I need to take to do that?
Yeah, so we have EMT, we have advanced EMT, and we have paramedic courses. They're our initial training. So those are kind of the steps that you go: EMT, advanced EMT, paramedic. So for your EMT, you need a 12th grade reading level. You can come take that test here, or we give you credit if you already have taken that class in college. For the advanced EMT and the paramedic, you'll also need math, and you can come out here and take that test as well. And we'll give you credit if you've taken a math class in college. Also, we always like to meet with our students before they get into the program. So you can come out here and meet with any of our full-time faculty. We're always here to serve you Monday through Friday, and we would love to have you.
And how long is this program?
So your EMT is going to be 16 weeks, so about a semester long. That's a 9-credit-hour class, and it's usually a Tuesday, Thursday, or a Monday, Wednesday. Advanced EMT is around 20 weeks, and your paramedic, you're looking at about 11 months.
So I could be on the job in less than a year.
Yep, on the job making some money.
Well, what other certifications or short-term trainings do you offer?
So we offer a lot of online training, refresher classes. We have a community paramedic course. We have a critical care paramedic course. We offer instructor methodology. We offer those every 3 weeks.
And is there an associate degree available?
Yeah, so once you complete your paramedic certificate, we can drop you in the associate degree program. You take 2 EMS classes along with your general education requirements, then you'll have your associate's degree.
And I have to ask, is it available online?
All online.
Oh, I love it. Besides the obvious of driving an ambulance, what other types of jobs can becoming an EMT or paramedic open doors to?
Alternative practice settings came around during COVID. They started using paramedics in the cath lab. They started using them in the emergency department. I've even seen job postings where they use paramedics in dental offices now. Some of our graduates have went on to nursing school. We have a lot of our graduates that have done physician's assistant school, medical doctor, doctor of osteopathic medicine as well.
And so this is a great career path for anyone. What opportunities exist for continuing your education? Like where can you go from EMT to paramedic?
Yeah, so we offer in-person continuing education. Also, we offer what most people do is the online refreshers. We earn those every 3 weeks, so you can get into those at any time. You can email us and we can pop you in them.
What would you say to someone considering a career in emergency medical services?
It's a great career. We always get the cliche answer when we ask students why they want to do this. They want to help people, but it's really a passion to serve.
Great. Well, let's check in with one of your students now. This is Cameron Britt. He's a soon-to-be graduate of the program. Cameron, tell us about your experience here in the program.
I would say my experience here has been fantastic. There's great instructors, great relationships built. And I'd say the continuing education side of Robeson Community College has grown very, very fast.
And how has this course helped you to achieve your goals?
One of my goals has been to improve my skill set from experience right now in the Marine Corps Reserves and also wanting to go into law enforcement. So to have that skill set to do on-site procedures to save lives.
Well, let's talk about that because you've been a student here for a while. And tell us about your experience at Robeson Community College.
My experience here has been great. I think it's a great school. I built a lot of great relationships, even down to getting letter of referrals for jobs I've been to. I'd say it's rapidly growing, and these are some of the best instructors I've ever had.
So you were here early college, you said, and then you went and joined the Marine Corps, came back?
Ma'am. Yes, ma'am. I did the early college program, stayed here, got my associates in business administration, joined the Marine Corps Reserves, did all my training, and as soon as I got back, the week I got back, I started this EMT certification program.
Wow, you are a go-getter. What would you say to someone considering a career in EMS?
I'd say it's a fantastic career. Me personally, if you look in the book of John, chapter 13, Jesus gives the example of washing the disciples' feet and tells us to love one another as he loves us. I think that's a big thing. The EMS world, the first responder world, law enforcement, anything like that, the whole purpose is to serve others before yourself.
What would you say to someone considering attending RCC in general?
I would say attending RCC is a great choice. It's very fast growing, a lot of good instructors, a lot of good relationships out here. There's a lot of good leadership too. It's not just the instructors, but the management above them.
Well, that's a wrap for today. We hope to see you in the next class.
See you in the next class.